Hi, myself Dr. S.K. Aminabi, Professor in the Department of Pharmacology from VV Institute of Pharmaceutical Sciences, Gutlavaleru. Today we'll be discussing the topic that is anti-anginal drugs. Before going to this topic, let us discuss what is angina pectoris, what are the types of angina pectoris, what is the pathophysiology, treatment, and finally what is the classification of drugs that is used for the treatment of angina. So coming to the first one, what is angina pectoris? Okay, so angina pectoris is a symptom of ischemic heart disease, and it is due to an imbalance between oxygen supply and oxygen demand of the myocardium. So we can say that the demand of oxygen is more to the heart when compared to the supply. There will be a chest pain. That condition it is called as angina pectoris, and we can note here angina pectoris, it is not a disease, it is a symptom that the heart is saying it requires more amount of oxygen. Come to the next one. What are the types of angina pectoris? Classified into three types, that is stable angina, also called as classical angina. Next one is unstable angina, and third one is variant angina. Okay, so coming to the first one, that is stable angina. It is characterized by episodes of chest pain commonly associated with exertion. That is, whenever there is a physical exercise, there will be episodes of chest pain. That condition is called as stable angina. Come to the next one, that is unstable angina. It is characterized by angina at rest or increased frequency and duration of anginal attacks. Okay, next, in most cases it is common due to rupture of erythematous plaque and platelet deposition in the coronary artery, leading to progressive thrombosis. That condition it is called as unstable angina, which may be due to rupture of erythematous plaque as well as platelet deposition in the coronary artery. Okay, come to the last one, that is variant angina, which also occurs during rest as that of unstable angina, but the cause is different. This variant angina is due to spasm of coronary arteries. So these are the three types of angina pectoris, that is stable angina, unstable angina, as well as variant angina. Okay, so coming to the next one, what is the pathophysiology of this angina pectoris? So as we said earlier, angina occurs due to imbalance in oxygen supply as well as oxygen demand of the myocardium. So we can say that whenever the oxygen supply decreases or the oxygen demand increases, there will be angina pectoris. And the reasons for oxygen supply decrease is either it may be coronary atherosclerosis, coronary vasospasm, coronary thrombosis. These may be the true reasons for decrease of oxygen supply to the myocardium. And next, what are the reasons for increased oxygen demand by the heart? Either it may be due to increased heart rate if the heart is working more. Okay, even if we are working more, we take more intake of oxygen in air. Similarly here, if the heart is working more, the demand will be more. So whenever there is increase in heart rate, increase in ventricular hypertrophy, increase in contraction, or increase in ventricular wall tension, okay, there may be increased oxygen demand of the myocardium. So the pathophysiology is either the oxygen supply is decreased or the oxygen demand is increased. There will be imbalance, so it leads to angina pectoris. Okay, come to the next one, what is the treatment? Okay, so the drugs has to increase the oxygen supply, or there has to be decreased oxygen demand by the heart. Okay, so how to increase oxygen supply to the myocardium? It is to restore the blood flow, or to relieve the vasospasm by drugs, or to break the thrombi using thrombocytic agents such as streptokinase, urokinase, and prevent the thrombus formation by using antiplatelet drugs. Okay, so in this way the oxygen supply to the heart can be increased. Next one, how the oxygen demand by the heart or by the myocardium can be decreased. It can be decreased by reducing workload on the heart. Okay, and that workload on the heart can be decreased, that is preload can be decreased by using nitrates, afterload can be decreased by using calcium channel blockers, potassium channel openers, and heart rate and contractility, it can be decreased by using beta blockers. Okay, so this is the treatment, that is oxygen supply to the heart has to be increased or oxygen demand by the heart has to be decreased. Okay, so coming to the next one, classification of drugs, or the main drugs that are used in the treatment of angina. So we can say that the first class is the nitrates. The main class is the nitrates. They consist of nitroglycerin, isosorbide dinitrate, isosorbide mononitrate, and erythritol tetranitrate. These are the main class of drugs used in the treatment of angina pectoris. In addition to that, beta-adrenergic blockers, those are propranolol, metoprolol, thymolol, as well as bisoprolol. Okay, and next one is the calcium channel blockers. Those are verapamil, diltiazem, nifedipine, felodipine, amlodipine, okay, and nimodipine. And next one is the potassium channel openers, that is nicorandil, and other drugs, that is antiplatelet agents, that is low dose aspirin, clopidogrel, statins. Okay, these are the various other class of drugs that can be used in the treatment of angina pectoris. Okay, so coming to the first one, main class, that is nitrates. Okay, so mechanism of these nitrates, the nitrates, they act by releasing nitric oxide. Okay, and in brief to say, nitrates are mainly venodilators, and they also cause the arteriolar dilation, so they reduce both the preload as well as afterload, so the load onto the heart is decreased. Okay, so let us see the mechanism here. When the nitrates are taken, okay, denitrated, these nitrates are denitrated in the smooth muscle cell, so there will be release of nitric oxide. Okay, so and this nitric oxide, it will stimulate guanyl cyclase, so there will be increased amount of cyclic GMP, which leads to dephosphorylation of myosin light chain and decreases calcium concentration in the cytosol, that is inside the cell. Okay, so whenever there is decreased calcium concentration inside the cell, it causes relaxation of vascular smooth muscles. So this is the mechanism how the nitrates they are used in the treatment of angina. Okay, so coming to the next one, what are the pharmacological actions of nitrates? Okay, as we said earlier, these nitrates, they cause venodilation, arteriolar dilation. They also dilate large coronary blood vessels as well as collateral vessels. Okay, so whenever the veins are dilated, that is venodilation occur, that is venous return to the heart is decreased, so there will be decrease in preload, there will be decrease in cardiac output, so the oxygen requirement to the heart or oxygen demand by the heart is decreased, so there will be relief of angina pectoris. Okay, so whenever there is arteriolar dilation, there will be decrease in peripheral vascular resistance, there will be decrease in afterload. So again same, there will be decrease in cardiac output, oxygen demand by the heart is decreased, so there will be relief of angina pectoris. So these nitrates, they are also used to dilate large coronary vessels as well as collateral vessels. So there will be increased blood flow to ischemic area due to redistribution of coronary blood flow. So there will be increased oxygen delivery to ischemic area, and so there will be relief of anginal pain. Okay, so coming to the next one. On the smooth muscles, these nitrates, they are having relaxation effect on bronchi, esophagus, as well as biliary tract. Okay, so coming to the next one, pharmacokinetics about these anginal nitrates. These drugs are mainly taken by buccal cavity, skin as well as skin, and they undergo first pass metabolism, hence oral bioavailability of the nitrates is very low, so the preferable route is the sublingual route, and onset of action is within 2 to 5 minutes, and absorption through the skin is very slow, hence the transdermal route is used for prolonged effect. Okay, the metabolites are excreted in urine as glucuronide derivatives. Okay, so coming to the next one, we can say here what are the adverse effects of these nitrates. The main adverse effect of these nitrates is vasodilation, so there will be headache, postural hypotension, tachycardia, palpitation, weakness, as well as flushing. Okay, uh, so next one is let me show the video of mechanism of action, how these nitrates will be acting.